Yeah, good evening. My name's Rob Ryder, speaking out of West Cornwall, and here I am again, joined with Patrick Quanton from Andalusia. Hi again, Patrick.
Hello.
Yeah, so I thought I'd do, before we go on tonight, a quick recap from where we were last week. So we've gone on from trauma to allergies and levels of toxicity. Um, so I think if we quickly go through this, an allergy doesn't necessarily have to represent something that would normally be toxic in our environment, should we say? So the classic example is pollen, and we said actually it's more what the meaning of the allergy rather than the allergen itself. That was, if you're going to go into the deeper route. You did also mention on a slightly the first time we went into the physical world slightly, in that there are levels of toxicity, whether natural or more chemical, in this very extra clean Western environment you talked about, that can sometimes go beyond our ability to cope. So our body in its natural state can cope with toxicity in the environment, but there will be a natural limit within the individual. And waste and toxicity is actually also a natural part of what we'd say biology. You mentioned that cells are burning waste all the time. That waste has to be flushed out. And we take in things from our environment, food, breathe through the air, and that can be maintained. But with what we would say chemical toxicity, it's more about the concentration and the amount rather than the things themselves. We can deal with toxicity. But if that's my level there of what I personally can deal with, once you start going above what I can personally deal with, you said then the body's going to start to respond a little bit more aggressively, shall we say, to the build-up. So we kind of had them two things there, whereas you have a natural toxicity build-up that can cause pressure on the system, but also the meaning of the allergen, which could be have its meaning in we use the example of a woman who'd been abused and we passed in the street and she had a very strong reaction. So the memory of that trauma was there. And that's how we spoke about allergens. So that's kind of a sum up from last week. And before I just give you comments on that, I know, again, I'll repeat the dog whisperer, Cesar Milan, who I've learned a lot of. When he's working with traumatized jobs, he hasn't got the extra bit of information he needs when dealing with humans, because dogs can't communicate. But he did find one aggressive dog once, was a Rottweiler, and he figured out by finding when it just by accident that there must have possibly been some trauma in the dog's past by being beaten with a broom, because he noticed it got really fearful, aggressive around a broom. And it took him a long time, but he had a strategy, because the broom isn't something that you can take out of the environment in life. You can always pass it. So in that instance, he couldn't change the environment. So he had to put on a new meaning of the broom, and it took time, but he started to use the broom during playtime. He'd have it just near the bowl at feeding time. And eventually the dog learned to associate. So the new meaning of the broom was affection. So that's kind of a way that, yes, some things are traumatic, but there are ways to move on and put different meanings on. So that's kind of the sum up from last week.
Yeah, associations, of course, are the basis of these things, because associations are how you've written down your original experiences, and that then forms the basis from which you are going to respond to similar experiences. And if your experiences then are not the opposite, not extremely good, if you like, then you can't unlearn, and you keep using the same response, and it sort of reinforces itself. So it gets stronger. And that is how allergies get stronger, and you get more, you start responding in an allergic way, in an overreactive way, to more and more things around you in the environment, because we are looking at things, we are looking at everything in a physical matter, in a physical manner. But of course, the physicality is an expression of energy. So it's always, what does this particular thing mean to you? And that is where what your response is based on. So the thing itself is meaningless. It means nothing. Yeah. Any tool that you put on a table and that the person at the table has no idea what the tool is about or what it is for, will not be able to use it, can't do anything with it. So you have to learn about it first before it means something to you, and then it means something. And to some people it will mean danger, to other people it will mean a help, or it's neutral, or and that is always what we need to look at, really, instead of saying, oh, the gun is dangerous. The gun is not dangerous. The gun doesn't do anything. Yeah, it's your response to the gun that may be dangerous, or not at all. You know, the person in the response to the gun may feel safe instead of being frightened. So it's all about these associations, really.
Yeah. So, so going on from last week, when you were talking about when your ability to clear out natural waste and toxins goes above your normal, you get these inflammatory responses from the body. So that's kind of a nice way to lead on to what we're going to talk about tonight, which is mainly the inflammation process and acute illness, which are kind of like the first signs that something's starting to give way and that is a little bit too much pressure on your individual life.
Yeah, there are some things that we have to take notice of with regards to inflammation, and everybody can take notice of these things. One is, there is no obvious reason for an inflammation. Yeah. Yes, sometimes the doctor will say, oh, you've overstrained your ankle, right? Or you have an inflammation of your gut or your stomach. So it's been whatever, too hot food or too spicy food, or the coffee, or whatever it is, whatever he says that it is. But if you look at every inflammation that you come across, then the great majority cannot be linked to anything that person has done at all. In other words, it's a spontaneous function of the body. It just happens. And the other odd thing about it is that when you leave it, it goes away again. So during the inflammation process, something has changed within the body. It started at some point, and then you get the inflammation, and then it disappears spontaneously again. It comes spontaneously and it disappears spontaneously. So the question is, why does it happen? What makes the system respond in an inflammatory way? It creates the inflammation itself, right? So we need to consider the fact, why would it do that? And then we can go on and see, what does the inflammation actually do to whatever it is that has caused it? And it's not the tomato that you've eaten or the alcohol that you've drunk or whatever it is. It must be something different. First of all, I would like people to take notice of the definition of inflammation. because I'm well aware of the fact that quite a lot of doctors, I'm not saying most, although I'm thinking that, no longer know what the definition of inflammation is. Everything, when you've got some pain in your knee or whatever, the doctor says it's an inflammation. No, an inflammation is a very specific definition in the medical book. There are 4 symptoms that need to be present at the same time. All 4 of them. What are they? Heat, development of heat, a swelling of the tissues, redness of the tissues, and pain. All 4. In other words, when you're complaining of pain, a painful knee, and you touch it with the back of your hand to find out whether it's hot or not, if it's not hot, it's not inflamed. You still have pain, but it's not an inflammation, in spite of what your doctor tells you. The reason he tells you that is because, and the reason he's been told that that is what it is that when he tells you it's an inflammation, he can then sell you some anti-inflammatory drugs. If he tells you it isn't an inflammation, why would you take anti-inflammatory drugs if it's not an inflammation? That's silly. So everything, every pain or every swelling or whatever it is, it's now called an inflammation. But that is not correct. An inflammation is a very particular process within the body. And it shows those 4 signs every time. That's an inflammation. It can happen in parts of your body, and it can be the whole body can be inflamed. You could have a fever, right? Which is extra heat, together with a rash, redness, swelling, not all over the body, but on your skin. And you may have local pains. Then you have a more general inflammatory response of the body. It can be local, it can be more general. Now, another interesting part is that the definition of infection or the symptoms of infection are exactly the same as the symptoms and the signs and symptoms of an inflammation. Exactly the same. Those 4, nothing else. What is different? The difference is that they do a swab of the wound or your throat or whatever, or your urine sample. And if they find bacteria or parasites or fungi in it, then they call it an infection. So an infection is basically inflammation plus bacteria. Then they got a problem. Well, it wasn't really a problem because it was already solved before the problem arose. But even from my own practice, very often, and you would have told the patient, you've got an infection. And then you sent off a sample to the laboratory to actually see what kind of bacteria it is. And if they found bacteria, they will test it against certain antibiotics. So you would then be able to target the antibiotic to that particular bacteria in your treatment. So you send off the sample. Sample comes back negative. No bacteria in it whatsoever. Yet it looked like an infection. You thought it was an infection. Why did it look like an infection? Because it is an inflammation. An infection is an inflammation. So it looks the same. You expect it, as a doctor, you expect it to be infected. In other words, to have bacteria in it that are not supposed to be there. And why are you expecting that? Because it's a heavy inflammation. It's a serious one. And so you think it must be infected. Comes back negative. So it isn't really an infection. It's only an inflammation. And the truth is then that if it comes back, well, the truth was, because nowadays doctors behave differently. But the truth was that if it came back with a negative test result, then the patient didn't need to have any antibiotics because there was no point. So if you already started them on antibiotics, you would then, after 4 days, when you got the result back, say, you can stop your antibiotics because they're not doing any good anyway. It's not infected. That was the point. So inflammation, and inflammation plus bacteria is infection. That's how it used to be. Nowadays, an inflammation without bacteria is a viral infection. That's a good one because you cannot prove the presence of any viruses. And because you can't, you don't have to. You just say it's a viral infection. This now, as a diagnosis, you can use after you send a sample off to the laboratory, which comes back negative, or you can just look at something and go, it's a viral infection. What are you looking at? An inflammation. An inflammation, that is what you're looking at. And that is all it is. So you've got an inflammation when you have those 4 signs, those 4 symptoms that are present. You've got an inflammation. Anybody can diagnose that now because they know the 4 signs. And then the only difference would be that in a small percentage of those inflammation cases, you would find the presence of bacteria, which also means your bacteria are not responsible for the inflammation. They're not responsible for the initial reaction or action that your body took. Don't blame it on them. They may be there, but most of the time, they're not there at all. So a viral infection is just a simple inflammation, nothing to do with viruses, just as the inflammation has nothing to do with bacteria, not the cause of it. So what else? What can be the cause then? Why would a body respond like that? Because this is the thing that we're now looking at the physical matter. Yeah? We're looking at the inflammation, which is a physical reaction. So the first thing to do is to think about or to try and figure out why I'm seeing this physical reaction in the body. And then we can see whether we can translate that a bit into an energy system. So 4 symptoms. What do they mean? So if the body increases the heat, what does that mean? It means that a lot of structures, so molecules, when you warm them up, they turn, like the states of that matter come into solid, liquid, gas. And you go from cold to hot. So when you start to warm up tissues, cells, then some of these connections of the atoms and molecules will loosen, and eventually they will break, they will fall apart. So the structure, the living structure, starts to come apart when the temperature is raised. So that is what heat does. It loosens the structure and some of those molecules will fall apart. You can visualize it by throwing some wood on a fire and watching how the structure of that wood just disintegrates because of the heat. That's what happens. That is what the heat does in living tissue. What else? Swelling. Your tissue swells up. What is that? It's so the area is attracting more water. Why would it attract more water? Well, what do you use water for? Cleaning. You wash your face with it. You wash the floor with it. You wash your clothes with it. It's for cleaning, right? So it means that there's dirt there. That is why the system is creating more or attracting more water to that area. Third symptom, redness. The tissue appears more red than it normally is. This is because the blood vessels are opening up. So what does that mean? It means that you get more blood that is drawn to that area. So you get more blood going through that area. You get a better circulation. What does the circulation do, or what can it be used for? It's transportation medium. Yeah, it moves stuff out. So we've got disintegration of structures, living structure. We got more water to put the rubbish, the waste in, and we've got a more efficient circulation to move the waste out. What's the pain? Pain is a signal from the body that makes your conscious mind take note of it. So you're going to pay it attention. If you pay attention to a certain area, you're actually pointing energy in that direction. So there's more energy going to that. Therefore, more energy means that the cells of that area have a higher metabolism. They can manage their work better. They work harder. So the 4 symptoms that we see make sure that the tissue that is inflamed, the cells in there, work harder. There's a lot of waste lying around that is put into water and is taken away by the circulation. So basically, your inflammatory reaction, which is spontaneous, you don't know about it until it is in full swing. Your inflammation is an action from the body that in certain parts, there is an accumulation of waste products, breakdown products, cellular breakdown products, and it is accumulating in a particular place. So now the system is going to use those 4 methods to help it clear it out. Everything that is part broken needs to be broken down to smaller pieces, put into a vehicle, water, and being transported away from the site. So once the debris is cleared out, the inflammation will disappear because the body will just retreat the signal. The heat goes down, the swelling goes down, the pain goes down, and the redness goes down, and it's gone. Back to normal. So, if that is the case, then inflammation, the process of inflammation is actually a cleaning up job that the body is showing us And it does that whenever it's needed. The body, the mind knows what is wrong, where it's wrong, when it's wrong, and it starts clearing it up. It deals with it. And when it's left alone, it will clear it up completely. So if the inflammation that you're looking at is going on for a long time, weeks, it means that that area is still continuously overproducing waste products. So there is something chronically pushing it, something chronically wrong with it, that results in a high amount of waste products, continuance. While in other conditions, more normal conditions, you get a spontaneous inflammatory reaction. It increases, comes to a high point, decreases, and disappears. All spontaneous, there's nothing you need to do. Whether there are bacteria in it or not doesn't make any difference at all, because the process of an infection, as well as an inflammation, the process is an inflammation, which is a spontaneous healing reaction of the body. The mind has organized it this way to heal you, to keep you or that site clean. Get rid of the problem. And the problem is an accumulation of waste. How does the accumulation of waste happen? Well, most of the waste, almost all waste inside our body comes from cellular activity. Every cell burns energy in order to do its activity. Whatever that activity is, it uses energy for that. When you burn energy, you create an action and it leaves waste products behind. So the more waste products a cell produces, leaves behind, is an indication for how hard that cell is working, how much energy it's burning. If it's burning a lot, continuously burning a lot more energy than normal, in other words, than what it requires to do its normal function, then it may come to a point where that energy is not cleared out from that side, taken away from that side quickly enough. So it accumulates. And then the system introduces the inflammatory process. So why would a cell start to work harder, burn more energy? When it's over pressurized, when there is a lot more pressure on the cells, then it will need more energy to overcome that pressure. You can feel that yourself. You know, if you increase your level of the amount of energy that you exercise, so the power, if you increase your power, you burn more energy, you get tired more quickly. Yeah. You then even start to create some of those inflammatory signals, because you get hot, you may get red in the face, and you start to sweat. Yeah, there's your circulation bit. So why would a cell then burn more energy, need more energy, when it's pressurized? The cell is part of a whole system, you as a person. If you put that cell, those particular tissues, under more pressure, and you do that for a long time, then those cells, the waste that those cells leave behind, will not be cleared out properly and quickly enough. So then you have the circumstances in which an inflammatory reaction will occur. Pressure. The pressure on the cell is the pressure on the tissue where the cell is part of. The tissue is part of your system, your personal system. So if your person, areas in your life are continuously pressurized, that will translate itself into some physical parts of your body becoming stressed, becoming functionally under strain all the time. And those are the circumstances in which you get inflammatory processes. And they will repeat. You know, initially, the inflammation will clean up the whole thing if you leave it alone. Yeah, if you take antibiotics, you put a lot more waste products, if you like, or at least products that the system needs to get rid of into your system, which will slow down the healing process. But if you leave the inflammation alone, it will heal up completely. But gradually, as your whole system, as various parts of your system become strained more and more and more, so there's now waste products lying around everywhere, and now you get one inflammation after another. Then it's this side, then it's that side, then it's this, then it's one after another. But inflammation, the inflammation action of the body, because, you know, it doesn't react in the same way, or it's not a reaction in the same way as allergies are a reaction, an overreaction to a trigger. Here it's just an action. The action is to clean up the site. This spontaneous action comes from the pressure that your system is under, the life that you're leading. You are forcing these cells, the tissues, to work on the circumstances that they're not made for. And you will accumulate waste first in one place, then in more places. And that is the basis of what doctors call disease. Because whenever you go and complain that you've got some pain somewhere, they say you've got an inflammation, which means you're ill. But that would mean that your system is actually doing something to make you ill, spontaneously, without you asking for it. Because the inflammation process starts without you knowing it, without you doing anything. So it's your system that is making you ill. That is what the doctor wants you to believe. He's the saving grace. He can save your life. And your body and your mind, that's your enemy. So the inflammation process is called a disease. While in fact, as we've just analyzed it, what it's doing is cleaning up the waste products, the debris, cellular debris. That is what it's doing. So how can a cleaning up job be a disease? And that, I think, is one of the most important things to understand if you want to really start to understand how other acute diseases come into being.
Yes, so I've got some observations there. Because there's quite a few, probably stick to the routine of going one by one. So there's something you mentioned there early on that I've only ever heard Trevor Gunn, the biochemist, say. Now, I'm sure there are a lot of other, what we'd say, natural therapists who use this, but I've only heard you and Trevor say it, in that inflammation or disease is a process and not a thing. So you only there mentioned the process of inflammation, which means or gets me to see that there's a state of being that's happening, that's been affected, and it's a changing process. And the medical profession give it a name and call it a thing, and then this thing is now a problem. Which also adds the other observation that is this an intelligent process, which you've explained, or the medical profession see it as something that's gone wrong in the body. Now, whether they mentally are aware of that's how they see it, that's how they treat it. Because you get an inflammation, you give an anti-inflammatory. So you've got more experience than most because you've been through medical training. So I'm just wondering, can you give me a little bit of background on the training of inflammation to see what the doctor's mindset and how they're missing the process and seeing the thing?
Well, the best way to train somebody in a particular mindset is not to mention anything else. So right from the beginning, you're trained to use the word inflammation as in, like you said, something is wrong. Yeah? Why is it wrong? Well, it's simple. Because yesterday, when you were okay, feeling okay, it wasn't there. Now I woke up with it. So that must be wrong. And there is no thought given to why this would be. Yeah. And it's cleverly done in a way, because if you're looking at an inflammation and they make you think about an infection, then you know, or then you will mention what has caused it. Yeah. You then go, oh, it was an E. coli bacilla, or it was TB bacilla, or whatever. Yeah, it was this particular organism that has caused your infection. With inflammation, they'll ask you things. What have you done? What have you eaten? What have you this? What have you that? Because it must be your fault. If it's not an organism's fault, it must be your fault. But if we can't put our finger on anything that you've done or not done, yeah, and it goes this far, I wake up with a painful neck. So I go to the doctor, and the doctor tells me I've got an inflammation of the muscles in my neck. And the cause is I've been lying in an awkward position during the night. So I'm to blame for sleeping in a position that has caused an inflammation, something could to go wrong in my body. So most of the time, by just asking you, they're not able to identify what you consciously have done wrong. So they shut up about it. Yeah. And when you as a patient keep asking, but why? Why does my body do this? Why this? Why now? He says, oh, it happens sometimes. Things go wrong, just like that. So there is no training that allows you or that makes you think about it. Yeah. And that is crucial to giving these people, giving the doctors, but everybody, the nurses, the physiotherapists, pharmacists, give them a one set mind. It's just one thing, and that's the only way they can think about it. And nothing else matters, and nothing else plays a part.
For me, it's almost, obviously I was never medically trained, never looked into natural health until I started researching. But when somebody breaks down the four things of an inflammation, even then, my mind starts to think that's interesting before it's even explained. And then when it's explained, it's so unbelievably obvious, mind-bogglingly obvious, really, that the last thing you would do is stop that process.
Yeah.
Even if you don't know exactly what has caused the tissue to become under pressure or sick, ill, producing waste, toxic, even if you don't know, what you do know is those 4 symptoms, there must be part of a healing process. It's so mind-bogglingly obvious. And the fact that the heat can be general or local means that the body's actually controlling that as well. It has the ability to decide where the heat goes. So it's mind-bogglingly obvious that there's an intelligent process going on there.
Yeah. And what is interesting is that if you realize, if you know that it's a healing, so by the time you experience your inflammatory process, you're already on the mend. You're already healing because your body has already responded to whatever it was. And indeed, you don't need to know. What you do need to know is how long does it go on for? Because if it disappears 3, 4 days, a week, fine. Yeah. But if after 3 months you still not got rid of your inflammation or not completely, that means now the thinking does play a part, because now you really should be thinking, I am overpressurizing my system. So what can I do to stop doing that? So in the initial process, you don't need to know what's caused it. You don't need to do anything to make it go away. If you do want to help, then it's very simple. Stop your life for a moment. Declare yourself ill, stop eating, go and lie down, rest a lot, don't solve any problems, stay emotionally and mentally calm and within yourself. And you just wait. And that will help the healing process. So whatever it was that caused the reaction doesn't matter because it's clearing it up by itself. Great. If it's impossible for your system to clear it up by itself, then it warrants the question, what am I doing in my life that puts so much pressure on my system that it's overworking continuously? So it's in hyperdrive continuously. Nobody can survive that for a long time. So then you need to start thinking, but the thinking then is based on that you understand what the process is about.
Yeah, I know. I would say I haven't been what you would call ill for many, many, many years. Ever since I started looking, since I understood illness as a health cleansing process, I used to get, you would say, a very, very heavy cold stroke flu once every about 18 months. And obviously I'm self-employed, I've got a family, I consider myself the provider of the house. You be a man and you work through it, but your body has a limit. And what used to happen, I'd work through it. I think, oh, I'll tough it out. I'm tough. I can do it. But then all of a sudden, boom, you're completely gone. And instead of having maybe 1 or 2 days off, you have 4 days off in bed.
Mm-hmm.
And then when I started figuring out what this all meant, so I'm a person, once I know something's right, I change my life in 1 day. And then, so that's it. Done with medicine, done with doctors, done with tablets, everything. I'm done. And then probably about a year later, I got one of these heavy, heavy colds again. Instead of working through it, I went to bed 3 days, no painkillers, and just toughed it out felt better afterwards, carried on. About a year later, it happened again. And this time it was about 2 days. But what I was doing, once I sensed it coming on, that's when I rested instead of continuing until my body just collapsed. And now I felt in them two processes was two big clear outs. And now I'm always conscious of how physically and emotionally tired I'm getting. And so I always make the decision, if I'm tired now and I can sense it, I'll finish work early, maybe not have tea, go to bed, some hot tea or something, and I'll get up for work the next day, but I won't put the alarm clock on.
Right.
And that normally does it. Normally does it. Christmas time is quite busy for me because I have to do 3 weeks work in a month, and the weather's been awful. And so a few years ago, I went to bed after quite a busy Christmas, and I fasted for 3 days. The second days, I could hardly walk. So the first day, my body's clearing out all the food from the previous day, starting to rest, and then I could literally hardly walk for about 24 hours. And then on the third day, things really calmed down. And I realized that was all the little niggles that I'd been working through. I'd finally gave my body time to fix everything. And the weather's been quite bad here recently in West Cornwall. So I've got 2 days work left, and I already know I'm going to go to bed for 2 or 3 days. Turn the phone off, maybe read a book, watch a film, maybe out of them 3 days, I might not eat. I might just have a bit of herbal tea and just relax. And I know my legs are ache. And the thing is, I'm conscious of it. And that's why I never let it go further than I know what I can cope with. So I think becoming aware of the process itself and understanding it, how you've explained it tonight, even if just people can take that on board, then they can notice their own signs.
Well, wait a minute, because when you realize what it is, then it's a revolution. The flu is a healing process. It's not a disease. The flu is an inflammation of your throat and back of your nose, and that's not a disease. So it's a healing process. Inflammation is a healing process. Infection is an inflammation plus some bacteria. It's an inflammation. It's a healing process. An infection is a healing process. That is why they happen spontaneously. Yeah, you don't need to fill yourself up with dirt in order to get an infected body. It doesn't work like that. It comes from inside because it's a healing process. So inflammation is not a disease, but that means an infection is not a disease. So how many acute diseases can we lift out of the medical books and say, not a disease, not a disease, not a disease? It's an awful lot. It's an awful lot of things that are called diseases that are based on inflammation, right? So they're not diseases. They're not even, you can't even call them acute diseases. No, they're acute healing processes. And then everything changes, because now when you then go through such an acute phase, it means you don't have to respond to it. You don't have to panic. You don't have to do anything. You just have to watch it and wait and allow your system to, as you explained, time and space to do its job, the job that it started. Yeah, so give it time. I've started, so I'll finish. But if you keep pushing yourself and you keep taking paracetamol just so that you can go to work, or that you can, look after the kids or whatever, while really your system would like you to lie down and not get up again, well, yep, you can force yourself, but only so far. And then, of course, the fact that it was a cleaning up process in terms of material matter, waste products that are accumulating. If you don't clean them out, the mountain grows. And that means that the effect on your health will suddenly become much worse.
Yeah, I think sticking on that note, I think the reason why this particular conversation is important, because once people have that moment of, wow, it's a healing process, and that light bulb goes off, then you have to face the truth. So for me, it was quite easy when I had the flu or whatever you want to call it, you know, severe headache, body aching, you feel like you've got no energy, everything. I knew it was just a process I had to go through, and that there would be light at the end of the tunnel. Unfortunately, what happens, what I've seen when I've tried to explain this to some people, sometimes a process will have to get worse until it gets better. And like you say, when you give into the process, you're focusing energy on that area, and that can then seem to you as things are getting worse, when in fact, actually, you're allowing more energy towards it. And there seems to be a peak. And just coming to that peak is when people tend to panic. And then they go back onto the antibiotics, the paracetamol, the anti-inflammatories, because they just haven't quite got that belief enough to get over that peak, and then it comes down quite rapidly.
It means
so I think listening to this tonight is important.
Yeah, it means maybe they've heard the story, or they've heard that it's a healing process, but they don't really believe it because it hurts and it's annoying me and it shouldn't be there. So get rid of it. You know, I might die. And if you listen to the doctor, he will tell you the inflammation can spread all through your body. It can spread to your heart and to your brain. You know, you can may get brain damage, or you may die of a heart attack. Yeah. Yeah. Well, yeah. If you believe it, because to me, the truth lies in observation. So observe what's happening. And it's not because you're feeling worse that you are actually, in health terms, that you are actually being worse. Because the more room and energy that is available for the process, the healing process, the more energy that will be used for it. So energy that is left over to do other things like staying awake, like eating, like running a marathon, will be far less, will be diminished. So you'll be feeling worse. But that's a good sign, because it means it's working. You resting means all the energy goes inside to the healing process. It'll be cleaned up soon. Wait, don't do anything. You're not dying.
Yeah, I think unfortunately people can listen to this video if it's new to them, but I think it's a process you have to go through. When I got my big heavy flu, when I got all this knowledge, and right, I'm going for it, there was no doubt in my mind. I wasn't taking paracetamol, I wasn't taking anti-inflammatories or anything. I'm going to go through this. And once you've been through it once, it becomes a lot easier then.
Yeah. And, you know, people don't realize, but if you block the process time and time again, you know, have a think about it. At the end of your life, yeah, what do people die of? They die of infections, yeah, inflammations. Why? Because they're full of crap and the system is still trying to clear it out. You know, so you can't escape it. You can postpone it by suppressing the process. But if you fail to restart it, the mountain of waste will get higher and higher. And eventually, all the system can do, it can't do anything else, is to try and burn it off, get rid of it. And it will keep trying to do that with or without your help.
Yeah, and I think another thing is, I mean, we did say earlier in the conversations, it's difficult to keep politics out of life nowadays because it's infiltrated everywhere. And this illusionary system, man-made way of living that we're forced to live in, it doesn't give people the time to take the rest, or at least they think they can't create the time. Sometimes you just have to create the time. And it's all, even though everything comes out of nature, it's almost like this illusionary system, the pressures of the system, the invention of suppressive medicines has almost created chronic illness in the fact that probably before the stresses of the system, people living simple lives, something may have happened. They'd have an acute illness. They'd either survive it or they wouldn't, and they'd get healthier. So chronic illness seems, on the surface, at least to me, to be another intelligent response by the system to cope with modern life and modern suppressive techniques, modern ways of living, the stresses of modern life.
It's not an intelligent response from your system. The intelligent response of your system only has to be right at the beginning of the process. So when something starts to go wrong, you need to know what to do to rectify it, and you need to do that. If you fail to do that, then it will keep going wrong, and what you know and how you can rectify it will fall short of the mark. So chronic diseases occur because acute diseases have never been solved. As you said, in nature, get an acute situation, nature responds to it, and it cleans it up completely. Or if you don't have enough energy left in your life because you're too old or too weak or to whatever, if you don't have enough energy to clean it up, you'll die. Yeah? And that's the only thing there is. But if you don't allow the cleaning up process, you start accumulating waste in certain areas, and then in more areas, in other areas, in other areas. And every time your body will try and burn it off. So you will get infection upon infection. You will get inflammation upon inflammation, whether it's in your gut, in your skin, in your nose, in your throat, in your lungs. But these are all attempts of the system to start an inflammation process, which is supposed to clean out the whole stuff. Yeah. But you're poisoning, by not allowing that, you're gradually poisoning your system continuously. And the modern way of life is putting more and more pressure on the system. I was thinking back, you know, just the pressure of a job, having a job. Now, I remember the time when people could take 3 days running off work just by phoning their boss and saying, I'm not feeling too well today, you know, I'm going to stay home today. They scrapped that. You needed a medical certificate to tell your boss that you were ill. But by doing that, you're forcing people to go back to work quickly because they think, oh my God, you know, I don't feel well today, but I need to go to the doctors. And nowadays, you can't just walk in, you know, sit there for an hour or 3 hours and walk out with a certificate, a sickness note. No, you need to make an appointment. So, but I can't have an appointment until 3 or 4 days away. but I'm feeling bad today and I need this sick note now. And so now I need to call the doctor for a visit to get that note. But that will cost me a lot of money. Or I'll go to A&E. But they complain because they've got too many people there that shouldn't be there. But they need to, because they need a certificate. So you're forcing people, really, or the system is forcing people to carry on, to go to work. And now we're at a point where they're saying, oh, wait a minute, you know, there are too many people off work on a long-term basis, 3 months, 6 months, over a year. We need to get them back to work because they can't afford it anymore, or they won't afford it anymore because they've got much better causes to spend their money on. So it's all about forcing people to continue the life that is actually making them ill, that is putting that extra pressure on them, so that the tissues continuously are working harder, continuously are producing more waste than necessary, and therefore they get acute illnesses. And they're continually doing this, you know, step by step by step, more pressure, and that is the modern way of life. And you don't have the luxury to say, I'm going to bed this afternoon.
Yeah, I mean, one of the reasons I've been self-employed most of my life is it gives me that option. It gives me a little bit of power of my decision making in my life. Like I said, I've worked hard now, but I'm going to go to bed for 3 days, and I'll just drink tea, read a book, watch some videos, film. So I've chosen that. I've chose to work hard this month. But I've made time to have a rest. And I know it's difficult for a lot of people, but as you've said, there's no other way. This is how the body works. If you don't find time for rest, the body will force you into it. If you can't find a couple of days off to switch life off, eventually the body's going to give you a month off to switch life off.
Yeah,
and there's no getting around that. Sorry?
Yeah. Or longer, you know, a month,
Yeah,
3 months, 6 months, 5 years. You know, people are done working because they can't anymore. From the moment they start again, 3 days later, they're back in bed.
Yeah. And I think everyone's under different pressures, you know. We've spoken, and we'll probably continue to speak more about the political system and the stresses it puts on us and this unnatural system. But people have just got to look at their own life and see, where can I take a pressure out here? Where can I take a pressure out there? Where can I get a bit of rest here? And I think I'm surprised how much the body can take. The body and mind is quite resilient. But there's little pressures that actually we put on ourselves that we don't need at all. Things like other opinions of ourselves on social media. So there's some ridiculous pressures in life that we can just get rid of straight away. There are certain families' responsibilities we can't, but we have to always, and coming back to that word balance, trying to get the right balance between what you need to do to survive and how are you going to do that to survive.
Yeah, and the pressures are everywhere, because just imagine, you know, that you didn't hear any news, no television, no social media, no internet, no radio, no news, right? So what would mean the Russians or the Chinese to you? What difference would it make what life was like over there, or what they so-called are planning to do, or whatever? You know, it's nothing to do with you. It's not an issue in your life. So therefore, consciously and subconsciously, your system doesn't have to deal with that information. When you put your antennae out, the information comes in and your system has to respond. It has to deal with that. And that's the difficulty. And they know that. That is why they tell us, we need to make informed choices. And we need to have information about everything, which means we have to have a meaning about everything. We have to have an opinion about everything. No, I don't. When it's nothing to do with me, I don't have to have an opinion. You can do whatever you like. I don't care. It doesn't make any difference to me. What is important to me is what my neighbor does, what they do in the village. That is what is important to me. All the rest, it shouldn't make any difference. But we have our antennae out and we're moving around and we're taking in information all the time and we're having an opinion about everything, and extra stress, extra waste, extra problem.
Yeah, I went through a stage a good few years back now where I actually dislike thinking. I don't see much point of thinking anymore. If I instinctually know what I need to know in that moment, if I trust my own responses to life, there's very few occasions when I need to think. That's why Edith does the washing machine, the dryer, the dishwasher, because I have to think and analyze the buttons, and it's not something I like to do in my life. It's been a strange few years that I think thinking's overrated when you trust your own responses and know that when there is a time to think, yeah, okay, right, I'll focus on this now. But apart from that, I think it's wasted energy.
The time to think is very limited because think about it. Yeah? Thinking is a rational process. Yeah, it has to do with rationality. Now, things that are not rational, like life, you don't have to think about it. Not a single thought, because it's worth nothing. The only thing you really need to think about is structures that are made by man and its consequences. Because those structures are logical. There is a rationality behind it. So if you can figure out the rationality, then you can deal with it. If you can figure out how the car, the engine of the car runs, then you can keep it running and you can alter it to whatever it is you need or want. So rationality, thinking is only required when it's about human structures. So society and all that sort of stuff. But emotions and psychology and life itself, you don't have to think about it. Just live it. That's it. Go with the flow. Go with your feelings. Don't think about it. It's a waste of time. And by the way, waste of time that burns a lot of energy, that creates an awful lot of waste.
Yeah, yeah, thinking and stressing and mental stress burns a lot of waste. And I'll go back to when we lived in Peru in the Amazon basin, and you go to the villages and you can actually see the people doing very little thinking. The guy's fishing is just fishing. The guy's making charcoal. We went on a village walk and bumped into some guys making charcoal. Very little conversation, just doing what they're doing. Very little thinking. We went on a riverboat because we had to go to another town along the Amazon, and you'll get people in dugout canoes fishing, just looking at you, and it's not that there's not a lot going in there because they're not intelligent. It's just that they just focus on what they need to do, and they do what they need to do. And I'm sure at the end of the day, they'll all go around into the village hall and then they'll do a little bit of chatting and thinking. But in their general way of being, if they're fishing, if they're washing the clothes in the river, if they're picking the fruit, their mind is completely focused, and it doesn't use up a lot of energy at all.
No, they're saving energy for what is really required, and that is to deal with life as it happens to them. You know, and so if they're just doing their routines, they don't need to think about it. You jump on a bicycle, you know how to ride a bike, and you ride the bike. You don't think about it. And anything that you don't have to do and it is not crossing your path, you don't have to think about it. What if a cyclone is hitting the village? Are these huts strong enough? I don't care. You know, we hardly ever get a cyclone here. So, you know, I'm not thinking about it. I don't have to.
Yeah. So I think we've got just a few minutes left. I think if anyone's going to take anything away from this tonight, it would be to use that word inflammation as a process rather than a thing. And if they can get the process, and you start to see things in a completely different way. And obviously, sometimes you have to go through one process to really believe in it and see it, the truth in it. And I think if people can just start see that process, and like you mentioned, initially an acute process, you don't need to think, you just need to rest. The system needs a rest to do some stuff. And then if it's going to linger around or reoccur, maybe you start to have to think maybe there's something a little bit deeper behind that. So that's kind of what I would say people to get to go away with tonight and see things as a process.
Yeah. And as a natural process, and you're part of nature, your system is looking after you and it's doing a good job. So get out of the way, stop thinking about it, stop whinging about it, stop panicking about it, and let it do its job. It's healing you, it's not making you ill.
Yeah, that sounds right. So that's probably it for tonight. I'm just checking the time. Possibly next week then we'll see possibly go into the digestive tract.
Good.
That could be an interesting one regarding the intake of food and the digestive tract itself, and how our emotions our life stresses, shall we say, can impact on that.
That's
that
fine.
Could be a good lead up to that next week.
Yep, we'll do that next week.
Okay.
Have a good night.
Yeah.
Bye.